Hey everyone, welcome back to all my listeners. This is episode 13 in season 16. Today is Wednesday, November 26th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, well, it is the day before Thanksgiving. So Thanksgiving Eve when this episode is dropping. So I hope everyone has taken a half a day today or taken the whole day off even. Why not? Be thankful for all of the hard work you have been doing the entire year. It's time to prepare that delicious meal, prepare your homes, and hopefully you are having family and friends over for tomorrow's big feast. So anyways, you guys, I just wanted to include my final episode this month. It's going to be featuring, of course, because it's the last Wednesday of the month, it's going to feature my Newsworthy fraud, waste, and abuse highlights for the month of November. And of course, I'm going to be spotlighting some of those from the month's criminal and civil enforcement cases that I find newsworthy. And in my Trusty tip, the last Trusty tip this month, let me give you guys a quick update on telehealth claims for Medicare. And I'm going to go ahead and close out and round out today's episode with another remarkable quote on resilience by the Dalai Lama. All right, you guys, let's get into it. So in today's Newsworthy, the month's fraud, waste, and abuse cases, the month of November saw a whopping 55 cases as of the recording of this episode. So yes, they did. They caught up really quickly after the government shut down, after the government reopened. They worked so hard, and there are 55 cases for the month of November. Now, let's check out some of those cases that I want to spotlight. Mid-November saw a diagnostic laboratory agreeing to pay more than $9 million to settle alleged False Claims Act violations. A diagnostic laboratory headquartered in Indianapolis, Indiana, agreed to pay the United States over $9.6 million to resolve allegations that it violated the False Claims Act and the Anti-Kickback Statute, the AKS. The government alleges that the laboratory knowingly submitted claims to Medicare for respiratory pathogen panels, or RPPs, that were either medically unnecessary or obtained through kickbacks. The lab also paid commissions to independent sales representatives and marketing firms, or 1099 representatives, based on the volume or the value of referrals. Now, specifically, the United States alleges that on November 20th, 2020, the lab entered into a marketing services agreement, an MSA, with a purported infection prevention company. Now, through the MSA, the lab agreed to pay the $5,000 per month in exchange for the quote-unquote marketing and management services in long-term care facilities. In reality, according to the United States, the MSA served as a pretext for paying the company for laboratory test referrals, which the lab then billed to Medicare. Additionally, the United States alleges that the lab paid the company to perform services in long-term care facilities, including specimen collection for infectious disease testing. The company swabbed residents for COVID-19, and the lab used the same specimens to conduct and bill Medicare for medically unnecessary RPPs. Now, in some cases, the lab billed for RPPs without performing any COVID-19 tests at all. Now, between December 1st, 2020 and May 11th of 2022, the lab paid the company approximately $1.86 million in exchange for RPP referrals. During this time, the lab billed Medicare for thousands of RPPs conducted at 43 long-term care facilities nationwide, receiving more than $6 million in reimbursement. Additionally, from January 1st through March 31st, 2021, the lab contracted with 1099 representatives to promote its laboratory tests to healthcare providers. The United States alleges that these individuals were not bona fide employees. The lab paid them a percentage of the revenue generated from testing they facilitated. The representatives helped arrange referrals and orders for tests billed to Medicare in violation of the AKS. The lab's commission payments to these representatives totaled at least $372,000. The claims resolved by this settlement are allegations only, and there has been no determination of liability. November also saw VRA Enterprises agreeing to pay over $17 million for allegedly billing Medicare for over-the-counter COVID-19 tests that were not provided to beneficiaries or that were sent to beneficiaries months after being billed to Medicare. A pharmacy located in Tampa, Florida, has agreed to pay the United States over $17 million to resolve allegations that it violated the False Claims Act, the FCA, by knowingly submitting or causing the submission of false claims to Medicare for over-the-counter or OTC COVID-19 tests that were not provided to beneficiaries or that were sent to the beneficiaries months after the pharmacy had billed them to Medicare. Between April 2022 and May 2023, the pharmacy distributed OTC COVID-19 tests in connection with the Centers for Medicare and Medicaid Services OTC COVID-19 Test Demonstration Project. During this demonstration project, Medicare Part B beneficiaries could request OTC COVID-19 tests from participating providers, such as this pharmacy, and CMS would reimburse those providers for up to 8 OTC COVID-19 tests per beneficiary month at a fixed rate of $12 per test. The settlement resolves allegations that the pharmacy knowingly submitted or caused the submission of false claims to Medicare for OTC COVID-19 tests in connection with the demonstration project. The United States contends that between August 2022 and May 2023, the pharmacy submitted claims to Medicare for OTC COVID-19 tests that they did not provide to beneficiaries. The United States also contends that in January 2023, the pharmacy submitted approximately 136,491 claims to Medicare for OTC COVID-19 tests that it did not ship to the beneficiaries until April of 2023. The pharmacy received thousands of complaints from beneficiaries during the demonstration project about missing OTC COVID-19 tests. The pharmacy also repeatedly acknowledged internally that it had billed Medicare for tests it failed to ship and should issue a refund to Medicare immediately for such tests, but did not do so. As a result of this conduct, the United States contends that the pharmacy knowingly submitted or caused to be submitted false claims to the Medicare program in violation of the False Claims Act. The claims resolved by the settlement here are allegations only, and there has been no determination of liability. November also saw Tri-Cities Urgent Care Clinic agreeing to pay $2.8 million to resolve claims of overbilling for diagnostic tests. An urgent care clinic with locations in Richland and Pasco, Washington, has agreed to pay over $2.8 million to resolve claims that it fraudulently overbilled Medicare and Medicaid for diagnostic tests. According to the settlement agreement, a False Claims Act, an FCA claim, arose from allegations that the urgent care clinic fraudulently billed for polymerase chain reaction, or PCR, respiratory and urinary tract infection panel testing. These panel tests were a predetermined group of medical tests used to test for multiple pathogens from a single sample obtained from a patient. The United States and the state of Washington alleged that instead of billing for a single panel test, the urgent care clinic improperly unbundled the panel tests and billed for each individual test comprising the panel. This resulted in overbilling to Medicare and Medicaid programs. In addition, the state of Washington alleged that the urgent care clinic improperly billed for panel tests that were more expensive and not medically necessary for individual patients, such as patients presenting with symptoms of COVID-19. November also saw CVS Pharmacy, Inc. agreeing to pay $18.2 million to resolve alleged False Claims Act violations. CVS Pharmacy, Inc. has paid a total of over $18.2 million to the United States and the state of California to resolve allegations that the company violated the Federal False Claims Act and the California False Claims Act when it knowingly submitted claims submitted for reimbursement for certain prescribed medications to California's Medi-Cal program that were not supported by applicable diagnosis and documentation requirements, according to the U.S. attorney on the case. Now, CVS is among the largest pharmacy chains in the United States with more than 9,000 locations nationwide and more than 1,000 stores in California. CVS submits reimbursement claims for medications dispensed to beneficiaries of the Medi-Cal program, which is California's Medicaid healthcare program administered by the California Department of Health Care Services, the DHCS. Medi-Cal relies on both federal and state funding to provide healthcare to millions of Californians, including those with low incomes and disabilities. Medi-Cal uses a formulary list that designates restrictions for certain listed drugs, including restrictions pertaining to diagnoses and required documentation that must be confirmed by the pharmacy before the drug can be prescribed. Drugs listed on the Medi-Cal formulary are commonly referred to as Code 1 drugs. Medi-Cal will reimburse certain Code 1 drugs only for approved diagnoses, taking into account criteria such as the drug's safety, efficacy, misuse potential, and cost. Pharmacies such as CVS serve the critical gatekeeping function of confirming and certifying that these Code 1 drugs are dispensed for the approved diagnoses. CVS may bill for drugs prescribed outside of the approved diagnoses, but it must submit a request to DHCS that includes a justification for the non-approved use. The settlement resolves allegations that CVS failed to confirm and document the requisite diagnoses and in some instances dispensed drugs for non-approved diagnoses, then knowingly billed Medi-Cal for those prescriptions. This settlement includes the resolution of claims brought by a former CVS pharmacist under the qui tam or whistleblower provisions of the Federal False Claims Act. Under those provisions, a private party can file an action on behalf of the United States and receive a portion of any recovery from that action. As part of the settlement announced, the whistleblower will receive approximately $3.3 million of the recovery proceeds. The claims resolved by this settlement are allegations only, and there has been no determination of liability. November also saw a founder/CEO and clinical president of digital health company convicted in a $100 million Adderall distribution and healthcare fraud scheme. A federal jury in San Francisco convicted the founder and CEO of a California-based digital health company and its clinical president for their roles in a years-long scheme to illegally distribute Adderall over the internet and conspire to commit healthcare fraud in connection with the submission of false and fraudulent claims for reimbursement for Adderall and other stimulants. The founder and CEO was also convicted of conspiring to obstruct justice. Now, according to court documents and evidence presented at trial, both men conspired with others to build a billion-dollar technology company and raise money from investors by providing easy access to over 40 million pills of Adderall and other stimulants in exchange for payment of a monthly subscription fee. Now, the pair spent over $40 million on deceptive advertisements on social media networks that sought to convince Americans challenged by a lack of structure during the COVID-19 pandemic that they were suffering from ADHD. The defendants also paid for targeted keyword search advertisements for drug seekers who wanted to obtain Adderall without a legal prescription. The evidence at trial showed that both men sought to place quote-unquote hard limits on clinical discretion by limiting the length of the initial appointment to less than half the length of a typical psychiatric examination and seeking to increase profits by refusing to pay for any follow-up treatment. In order to facilitate the illegal prescriptions, the CEO and founder paid nurse practitioners around the country up to $60,000 per month to refill prescriptions without clinical interaction and enabled a quote-unquote auto refill technology feature where patients could receive prescriptions without any clinical interaction for years based on an auto-generated email sent each month requesting additional prescriptions. The auto refill policy in some instances resulted in prescriptions being issued for deceased patients. Now, the CEO instructed employees that successful technology companies profit off addiction and offered an expensive luxury electric vehicle to employees who broke the law. The president told nurses to continue prescribing Adderall, even to patients who were abusing other medications, and to disregard the risk of going to jail. The pair also prohibited the independent clinical practitioners from discharging patients, and patients were not discharged and continued to receive Adderall even after concerned family members repeatedly notified the president that their children were suffering from bipolar, Adderall-induced psychosis, or other mental health conditions that could be worsened by continued prescriptions. In order to ensure that members continued paying monthly subscription fees, the men and others conspired to defraud insurers so that members would be able to use insurance to pay for Adderall dispensed at pharmacies. The duo and others submitted false and fraudulent prior authorizations requests to insurers, which claimed that the company followed the DSM-5 in diagnosing ADHD, utilized urine drug screens, and falsely claimed that non-stimulants had previously been tried without success. As a result, Medicare, Medicaid, and the commercial insurers paid in excess of approximately $14 million. In 2022, national media outlets reported that this company was making Adderall too easy to get online. In response to questions from the media, investors, and certain major pharmacy chains, the defendants made deceptive statements about the company's policies. While internal documents showed that the defendants followed a quote-unquote customer-first philosophy, where they attempted to obtain customer approval ratings higher than America's highest-rated retailers, offered second opinions to patients who complained of being denied Adderall, and that the CEO and co-founder, who had no medical training, ultimately was responsible for approving clinical practices. The defendants falsely denied the existence of these policies and claimed the company was run by independent clinical leadership. To obstruct the government's investigation, the evidence at trial showed that the CEO and founder moved operations to China to make personnel and evidence unavailable. The CEO and founder limited communications on company platforms, used encrypted messaging apps with disappearing messages, and deleted incriminatory documents, such as language encouraging the company's providers to provide Adderall even to patients who did not have ADHD. The CEO also transferred over $1 million to a Chinese shell company, conducted internet searches for countries that did not have extradition, and was stopped by law enforcement for leaving the country. The pair were both convicted of 1 count of conspiracy to distribute controlled substances, 4 counts of distribution of controlled substances, and 1 count of conspiracy to commit healthcare fraud. The CEO and founder was also convicted of 1 count of conspiracy to obstruct justice. The pair each face a maximum penalty of 20 years in prison on the conspiracy to distribute controlled substances and distribution of controlled substances counts. Sentencings are set for February 25th, 2026. The judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. Now, November also saw Vora Wound Physicians and its owner agreeing to pay $45 million to settle fraud allegations of overbilling for wound care services. The doctor and his companies, including Vora Wound Physicians Management, LLC, have agreed to pay $45 million to resolve allegations that they violated the False Claims Act by knowingly causing the submission of claims to Medicare for medically unnecessary surgical procedures, for more lucrative surgical procedures when only routine, non-surgical wound management had been done, and for evaluation and management services that were not billable under Medicare coverage and coding rules. Vora is one of the nation's largest providers of bedside specialty wound care for patients in nursing homes and skilled nursing facilities. In April 2025, the United States filed a lawsuit alleging that Vora engaged in a nationwide scheme to bill Medicare for surgical excisional debridement procedures that were either not medically necessary or had not been performed. In its complaint, the United States alleged that Vora pressured, trained, and provided financial incentives for Vora physicians to perform debridement procedures during as many patient visits as possible, regardless of the patient's needs. Furthermore, it did not matter which kind of debridement a Vora physician performed because Vora allegedly programmed its electronic health record and billing software to ensure that Medicare was always billed for the higher reimbursement surgical excisional procedure and to create false medical record documentation to support the scheme. Finally, the United States alleged that this widespread scheme was orchestrated by Dr. Vora himself and implemented by his senior management team. Under the settlement, Vora will enter into a 5-year Corporate Integrity Agreement, or CIA, with the Office of Inspector General for the Department of Health and Human Services. Under the CIA, Dr. Vora must develop and maintain a compliance program, implement a risk assessment process, and hire an independent review organization, an IRO, to review its claims and health information technology systems. The CIA requires monitoring of Vora's operations and obligates company executives and owners to certify compliance annually with the terms of the CIA. The claims resolved by the United States in the settlement are allegations only, and there has been no determination of liability. And now it's time for my best practice tips in Trusty Tip. Are we staying current on telehealth? I know my listeners are. But just in case, I wanted to remind you that there is even more change that has happened in this space of telehealth. On November 25th, 2025, that was just yesterday, the National Government Services MAC, or NGS, gave us an update after the end of 43 days of the government shutdown in the United States. And this document is all about Medicare telehealth flexibilities clarification. So, National Government Services has received several inquiries regarding the submission of claims now that Congress has extended the telehealth flexibilities from the public health emergency. With the passage and presidential signing of the Continuing Appropriations, Agriculture, Legislative Branch, Military Construction, and Veterans Affairs and Extensions Act of 2026, the telehealth flexibilities that previously expired on September 30th, 2025 were reinstated retroactively through January 30th of 2026. This means all provider specialties may again provide services via telehealth. There are no geographic restrictions, and patients may receive telehealth services from their home. Any denied or rejected claims submitted with the GY modifier for dates of service on or after October 1st, 2025 may be resubmitted without the GY modifier. Providers that were holding or did not submit claims for telehealth services impacted by this may now submit the claims for consideration under the continuing telehealth flexibilities. As mentioned, the telehealth flexibilities will continue through January 30th, 2026 at this time. So I really wanted to read that document that NGS just published on their website yesterday. So keep that in mind. If you've been holding claims after October 1st, or if you've been filing your claims with the ABN and the modifier GY appended to your telehealth service, you can now resubmit those claims or start sending those claims in for telehealth now that the flexibilities are going to continue in the Medicare space through January 30th, 2026. At this time is the big key phrase there, right? So currently, things are going to remain flexible, but after January 30th, we have to look again and see what Congress is going to do. If there's going to be sub-regulatory guidance that is provided, we're uncertain at this time, right? But for now, CMS came out and let us all know after the government had reopened, all of these telehealth flexibilities were made apparent once again. And my MAC, my NGS in this region for Illinois, they came out with a document on their webpage advising providers in this region of what to do with their telehealth claims. So make sure you are staying current with your MAC in your region in the US and make sure that that guidance is available for you as well. These Medicare telehealth flexibilities are once again happening. So our practices need to update their compliance programs once again and state that the guidance has changed from the CMS back to the flexibilities that they have been used to. So once again, stay tuned. You know, I will have much more to disclose after January 30th, 2026. And finally, I focus season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone whose words provide us with their insights on resilience. So in this week's inspiring quote in Spark is from the Dalai Lama. It is worth remembering that the time of greatest gain in terms of wisdom and inner strength is often that of greatest difficulty. So very true, right? When we are in hard times, when we are facing struggles, we often forget that it's within these moments, the messy, the uncomfortable moments, that we gain the most wisdom, that we achieve strengths we did not know we even had. So keep that in mind when you're faced with yet another hardship. It is your resilience that will carry you through to the other side. I'm happy the Dalai Lama's spark still burns brightly and continues to inspire so very many. Well, all right, you guys, that wraps up today's episode. You know, I really loved doing the final fraud, waste, and abuse cases here for the month of November. It was really hard to just choose those 7 or so cases out of the 55 that I reviewed for the month of November. But these were the really big ones that I wanted to touch on, especially for wound care. We know the Department of Justice and the OIG is looking much more clearly to our skin substitutes as well as wound care, right? The two kind of go hand in hand. So I really wanted to make sure I put the big spotlight on the Vora case for wound care because they really are the largest provider in the country to do these types of services. I really wanted that to be touched on, especially since they're so big. They are now under a CIA agreement, right? So all of their compliance has to be buttoned up rather immediately once they find their own independent review organization, that IRO. I know that things will quickly turn around for the positive so they can continue doing their very, very good work for their patient population, as well as all of the other cases that I put the spotlight on. I hope you got a lot out of them. I know I did. And of course, trusty tip for all of those Medicare claims, we have to jump through yet another hoop, but hopefully we still have all of that flexibility documented in our compliance programs. So we just have to look back through that again and make sure that we are continuing to honor those flexibilities and our providers can continue seeing patients the way they have been for quite a few years, right? Since the COVID-19 pandemic. So make sure you continue to reach out to me when you can. If you and your organization need more education, I'm always delivering webinars, speaking publicly, speaking at organizations live. I'm always happy to come out and provide continuing compliance education, especially for the telehealth space. So I know tomorrow, just a few hours from now, is Thanksgiving. So I wish everybody in my audience the most happy and substantive Thanksgiving, right? Full of those people that you love and care for in your life. Take the time to relax and unwind with everybody in your life that is celebrating the day with you. So anyways, you guys, I really, really wish you all the very best. And I look forward to next month with you as December rolls in and what's in store for all of us. So I wish you all an amazing and very, very happy Thanksgiving. Thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.